121. MI can cause Dressler syndrome weeks after the event. True or false? Answer. True. Rationale. Dressler syndrome, a post-MI pericarditis, occurs 1 to 6 weeks after MI due to an autoimmune response, per AHA complications. 122. The nurse should administer thrombolytics to all NSTEMI patients. True or false? Answer. False. Rationale. Thrombolytics are not indicated for NSTEMI, which is managed with medical therapy or PCI, as it involves partial occlusion, per AHA guidelines. 123. The nurse should assess for cyanosis in MI patients. True or false? Answer. True. Rationale. Cyanosis may indicate severe hypoxemia or cardiogenic shock in MI, requiring immediate assessment, per AHA clinical evaluation. 124. MI pain is always bilateral in nature. True or false? Answer. False. Rationale. MI pain is typically unilateral, often radiating to the left arm or jaw, though it may feel diffuse, per AHA clinical manifestations. 125. The nurse should teach MI patients to monitor their cholesterol levels. True or false? Answer. True. Rationale. Regular cholesterol monitoring helps manage dyslipidemia, a key MI risk factor, per AHA secondary prevention guidelines. 126. A normal troponin level 12 hours post-symptom onset rules out MI. True or false? Answer. False. Rationale. A normal troponin level at 12 hours does not definitively rule out MI, as levels may rise later or be normal in early NSTEMI, per ACC biomarker standards. 127. The nurse should monitor for bradycardia in MI patients with inferior wall infarction. True or false? Answer. True. Rationale. Inferior wall MI, often from right coronary artery occlusion, can affect the sinoatrial node, causing bradycardia, per AHA complications. 128. All MI patients experience diaphoresis as a symptom. True or false? Answer. False. Rationale. Diaphoresis is common but not universal in MI. Some patients, especially the elderly, may lack the symptom, per AHA clinical manifestations. 129. The nurse should administer heparin to MI patients with a high bleeding risk. True or false? Answer. False. Rationale. Heparin is contraindicated in patients with high bleeding risk, e.g., recent surgery, requiring alternative anticoagulation, per AHA anticoagulant guidelines. 130. MI can cause heart block as a complication. True or false? Answer. True. Rationale. Myocardial necrosis affecting conduction pathways can cause heart block, particularly in inferior or anterior MI, per AHA complications. 131. The nurse should teach MI patients to avoid sudden temperature changes. True or false? Answer. True. Rationale. Sudden temperature changes can stress the cardiovascular system, increasing MI risk. Patients should avoid extremes, per AHA lifestyle guidelines. 132. CKMB levels rise faster than troponin in MI. True or false? Answer. True. Rationale. CKMB levels rise within 3 to 4 hours of MI, faster than troponin, 3 to 6 hours, but are less specific, per ACC biomarker kinetics. 133. The nurse should administer morphine to MI patients with hypotension. True or false? Answer. False. Rationale. Morphine can worsen hypotension by causing vasodilation, requiring cautious use in MI patients with low BP, per AHA protocols. 134. The nurse should assess for nausea in MI patients. True or false? Answer. True. Rationale. Nausea is a common MI symptom, especially in women, due to vagal stimulation or ischemia, per AHA clinical manifestations. 135. MI can be prevented by regular physical activity. True or false? Answer. True. Rationale. Regular physical activity reduces MI risk by improving lipid profiles and endothelial function, per AHA prevention guidelines. 136. All MI patients require lifelong beta blocker therapy. True or false? Answer. False. Rationale. Beta blockers are recommended long-term post-MI for most patients, but not all, depending on ejection fraction and comorbidities, per AHA guidelines. 137. The nurse should monitor for signs of pulmonary embolism post-MI. True or false? Answer. True. Rationale. Post-MI immobility or ventricular thrombus increases pulmonary embolism risk, requiring monitoring for dyspnea or chest pain, per AHA complications. 138. The right ventricle is unaffected by MI. True or false? Answer. False. Rationale. Right ventricular infarction can occur, especially with right coronary artery occlusion, causing hypotension and elevated JVD, per AHA pathophysiology. 139. The nurse should teach MI patients to take statins with food to reduce side effects. True or false? Answer. True. Rationale. Taking statins with food minimizes gastrointestinal side effects like nausea, improving adherence, per AHA pharmacologic guidelines. 140. MI always presents with ECG changes at symptom onset. True or false? Answer. False. Rationale. Early MI may lack ECG changes, especially in STEMI or small infarcts, requiring serial ECGs, per AHA diagnostic standards. 141. The nurse should assess for confusion in elderly MI patients. True or false? Answer. True. Rationale. Confusion is an atypical MI symptom in the elderly, reflecting reduced cardiac output or hypoxia, per AHA geriatric considerations. 142. Thrombolytics are the preferred treatment for MI in patients with PCI access. True or false? Answer. False. Rationale. PCI is preferred over thrombolytics for STEMI when available within 90 minutes, offering better outcomes, per AHA reperfusion guidelines. 143. The nurse should monitor for elevated blood pressure post-MI. True or false? Answer. True. Rationale. Hypertension post-MI increases myocardial workload, requiring monitoring and management, per AHA clinical guidelines. 144. MI pain is always accompanied by shortness of breath. True or false? Answer. False. Rationale. Shortness of breath is common but not universal in MI. Some patients present with isolated pain or atypical symptoms, per AHA clinical manifestations. 145. The nurse should teach MI patients to avoid lifting heavy objects for 6 weeks post-MI. True or false? Answer. True. Rationale. Avoiding heavy lifting for 6 weeks post-MI reduces myocardial strain during recovery, per AHA rehabilitation guidelines. 146. All MI patients experience elevated CKMB levels. True or false? Answer. False. Rationale. CKMB levels may be normal in early MI or small infarcts. Troponin is more sensitive, per ACC biomarker standards. 147. The nurse should assess for jugular vein distension in right ventricular MI. True or false? Answer. True. Rationale. JVD is a hallmark of right ventricular MI, indicating right heart failure, per AHA clinical evaluation guidelines. 148. MI can be caused by cocaine use. True or false? Answer. True. Rationale. Cocaine causes coronary vasospasm and thrombosis, increasing MI risk, even in young patients, per AHA pathophysiology. 149. The nurse should administer ACE inhibitors to MI patients with acute renal failure. True or false? Answer. False. Rationale. ACE inhibitors are contraindicated in acute renal failure due to risk of worsening kidney function, per AHA pharmacologic contraindications. 150. The nurse should teach MI patients to report palpitations post-discharge. True or false? Answer. True. Rationale. Palpitations may indicate post-MI arrhythmias, requiring prompt reporting for evaluation, per AHA patient education guidelines. 151. MI can cause ventricular fibrillation as a complication. True or false? Answer. True. Rationale. Ventricular fibrillation, a fatal arrhythmia, can occur post-MI due to myocardial irritability, requiring defibrillation, per AHA complications. 152. The nurse should administer oxygen to MI patients with normal SpO2 levels. True or false? Answer. False. Rationale. Oxygen is not indicated for MI patients with normal SpO2 greater than or equal to 90%, as it may not benefit normoxic patients, per AHA 2020 guidelines. 153. The nurse should teach MI patients to follow a high-protein diet. True or false? Answer: false rationale. A balanced diet, not high protein, is recommended post-MI to manage weight and lipids per AHA dietary guidelines. 154. MI can cause cardiogenic pulmonary edema. True or false? Answer: true rationale. Left ventricular failure post-MI can lead to pulmonary edema, causing severe dyspnea per AHA complications. 155. The nurse should monitor for signs of infection post-MI. True or false? Answer: true rationale. Post-MI patients are at risk for infections, especially with invasive procedures like PCI, requiring monitoring per AHA clinical guidelines. 156. All MI patients require antiplatelet therapy for life. True or false? Answer: false rationale. Lifelong antiplatelet therapy, e.g. aspirin, is recommended for most MI patients, but duration varies based on bleeding risk per AHA guidelines. 157. The nurse should assess for chest pain recurrence in MI patients. True or false? Answer: true rationale. Recurrent chest pain may indicate reinfarction or ischemia, requiring immediate assessment per AHA clinical evaluation. 158. MI can only occur in patients with atherosclerosis. True or false? Answer: false rationale. MI can occur without atherosclerosis caused by coronary spasm, embolism, or demand ischemia per AHA pathophysiology. 159. The nurse should teach MI patients to take nitroglycerin prophylactically before exercise. True or false? Answer: true rationale. Prophylactic nitroglycerin before exercise can prevent exertional ischemia in post-MI patients, per AHA patient education guidelines. 160. The nurse should administer thrombolytics to MI patients with chest pain for 24 hours. True or false? Answer: false rationale. Thrombolytics are ineffective and risky beyond 12 hours of symptom onset, requiring PCI or medical management per AHA reperfusion guidelines.